So as I think I was saying in the talk, the two big ones that we see in bag and mask ventilation are leak around the face mask, and it's quite a difficult skill to get the face mask on successfully, particularly in tiny babies where the masks are often too big and there's substantial leak around the face mask, ineffective delivery of tidal volume, and the resuscitation doesn't go well. And the other big one is obstruction, so where the operator's either pushing the mask too hard down onto the face or hyperextending the neck or hyperflexing the neck and causing airway obstruction. And in our hands at least, those are the problems that we see that interfere with successful resuscitation. Okay, so these were babies less than 32 weeks and babies who the doctors who were at the delivery room decided needed some bag and mask ventilation, and they were randomised. They all had the respiratory function monitor placed in their breathing circuit, and they were randomised to either have that exposed so the operators could see what they were doing, or covered, in which case we were recording what was being delivered but they couldn't see what was being delivered. I think that's where its big role is going to be, and we've started to use it in that setting, and it's very useful for teaching people effective mask technique, because I think that's where the biggest improvements can be made. I think we need the big randomised trial. The trial I described this morning was a small, described it as a toe in the water approach. Could we do the trial? We're planning a multi-centred trial with many more babies to see if the benefits that we saw here are sustained in a wider setting, and I think that's what people are going to need to be convinced to invest in this sort of technology. We've done that in an informal way. I think at least initially there's the trainees can feel a little bit threatened by this technology and the idea that somebody's looking over their shoulder and can can measure what they're delivering. But once they've learnt how to use the technology and do better for the babies, then they become quite invested in the technique.